So the first lift that we're going to do is the deadlift. This is a really important one because it will be the basics and it will set you up for a good snatch or a good clean. So if you're not able to do the deadlift properly, then you shouldn't do any snatches or any cleans. So the deadlift looks a little bit like this. We have the hands on the bar and we lift the bar from the floor towards the hips. Let's do 1 rep. Yes, and go back down. All right. So as you can see with her, she goes through the full range of motion. She is able to maintain a good neutral spine and she just does the deadlift pretty well. This is because the posterior chain mobility for her is on a good level. If the mobility in the posterior chain is a little bit limited, then you will probably not be able to move like this. So if the hamstrings will be pretty short, it will pull the pelvis into a posterior tilt, rounding up the back. So that's something that we would want to work on before we do a lot of deadlifts, because if you deadlift with a rounded spine, it can be pretty dangerous and you will potentially hurt the spine from doing deadlifts like this. So that's something we don't want to see. And when we do a deadlift, the first thing that should come to mind is that we want to maintain a neutral spine throughout the movement. And the drill that we've used to establish this with a squat, we'll use the same drill with a deadlift for now, but now we're going into a hip flexion. So last time with a squat, we went to the knee flexion and a little bit hip flexion. Now we're going over into a bigger hip flexion. So I want her to come this way. Yeah, well, you don't need the bar for a few seconds. Then turn 80 degrees, 180 degrees. 3 points on the PVC pipe. Again, same as with the squat. So we want the back of the head on the PVC, then the thoracic spine, and then the pelvis. So the 3 points on the spine. You should be able to do this perfectly because you've practiced this. And we don't want to forget that, again, we want room over here at the lumbar spine, and we don't want room at the thoracic spine. So the mid vertebrae, no room, lower vertebrae, room, pelvis on the PVC, mid spine PVC, back of the head PVC, and we maintain this position throughout the movement. So we're going to do a hip flexion, and during this hip flexion, I want a small knee flexion and a big hip flexion. So I want her to go forward, let's go, maintaining this position, stop. Okay, as you'll see now, if she's afraid of creating a bigger hip flexion, so creating a smaller angle, but I want her to get the knees a little bit backwards. This would potentially pull the pelvis into the posterior tilt, potentially rounding up the back. So again, if she would have stiff hamstrings, then the back would round up when I ask her to extend the knees a little bit. So we want the knees to be a little bit flexed, but not too much. Again, room over here, no room over here. This is good, and then we go back up again. So this is the initiation when we would go back down into a deadlift. The first thing that we would do is a big hip flexion and a small knee flexion. So a small dip through the knees and a big hinge at the hips. Yeah, a little bit lower. Okay, hold it here. So when you're able to do this, so a hip hinge, we would call this a Romanian deadlift, where we get the hips back and we don't use the quad muscles a lot, so we don't flex and extend the knees a lot. This would be a Romanian style deadlift, but for a normal deadlift, we have a knee flexion right after we've done the hip flexion. So she goes back up again, and when she would go down, she would first get the hips back, and then when she's past her knees, then she would flex the knees again. And we're going to practice it with the stick. So we have the pelvis, mid vertebrae, back of the head on the PVC. First initiate the movement by getting the hips backwards. All right, and then when she's past the knees, then she goes down into a knee flexion. Yeah, and we go back up again. Right, then what we want to see throughout this movement, so if you're able to do this, is a good sequence. So what we want to see during sequencing of the deadlift is the first part, so when we come off of the floor to the approximately just above the knees, is that we push with our legs and we extend the knees almost towards 180 degrees. So when she goes down, and she's able to maintain this position, of course, further, 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 yes, a little bit further. Yeah, and then go down. All right. So the first part during the deadlift, so imagine that she has the bar on the floor, is creating that knee extension. So we want to create a bigger angle at the knees. So that's the first part during this part. So where she goes to above the knees, we want to be able to maintain that same angle from the PVC to the floor. So we don't want this point to go that direction. We don't want this point to go into that direction. So we want the hips and the shoulders to rise both at the same time in this fashion. So let's try it out. Towards just above the knees. Stop. You see this? You see that this goes up. So we want her to push a little bit more through the legs and get the hips a little bit upwards. Yeah, like that. Yeah, just above the knees on. Remember. Go down. Yeah, imagine that you have the bar on the floor. Okay, hold it here. A little bit upwards, the hips. Okay. Let's try it out one more time. Towards just above the knee. So we go up. Stop. Okay, she would be just below the knees now. You see that this point goes up a little bit. I want her to go down for just 2 or 3 centimeters. Okay. Get the hips a little bit upwards. Up, up, up. Okay. And push more through the legs. Okay, that's it. Stop. Go back down again. Yeah. So again, the torso moves in the same angle when we go up, and when we're at the knees, then is the point when we're past the knees, by the way, then that's the point when we finish up with hip extension and we get this point to point towards the ceiling. So we go up, 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 all right? And then when we've passed the knees, then we go up and make this point towards the ceiling. Yeah. Then we go back down. We do the same thing, but now in a reversed fashion. So the first thing that we'll do, just like we've done before, is we get the hips back. Yeah. Stop. Stop, stop, stop. Hold it here. Okay. Thoracic spine on the PVC. Yes. Room over here. The pelvis is on the PVC. Now we go down. All right, all right. Stop. So again, big angle at the knees, small angle at the hips. When we've passed the knees, then you can flex the knees even more and go into that low deadlift position. Yes. And go back up. Yeah. So again, there's 2 phases inside the deadlift. First phase is pushing with the legs. Second phase, when we're past the knees, we finish up the hip extension and get the torso from this angle towards 180 degrees. Now when we go down, we initiate the movement using the hips, so we get the hips back into that small angle. And then when we've passed the knees, then we flex the knees even more. So let's finish up with 1 good rep, and then we'll go over into another drill. Okay, hips back. Stop, hold it here. Yeah. Nice, nice, nice. Go up. This is something you want to do more often, guys. As you see with her, when she goes down into that deep deadlift position, you'll see that this point goes up a little bit. That's something you also don't want to see. So when you go down and you pass the knees, and we want the angle to be exactly the same. When we go down and we flex the knees, and then when we go upwards, we want the same angle again. And we want to change this angle when we're from above the knees towards at the hips. Then is the time to change that angle. When we're below the knees, we don't want to do that. Then we're going into another drill, and this drill is to get you to arch the back. So if you're having trouble arching up the back, so making that neutral spine, then you can use this drill to teach yourself how to do this. So what you'll do is you are going to sit on the bench with the feet besides an object. So that would be a ball, a dumbbell if you have that. We have a medicine ball, but a box would do just fine. Maybe your husband or your wife could also be an option. So we have the feet besides the medicine ball for now. Okay, and we're going to lift the medicine ball with perfect form. What we're going to do, we're starting off by creating that big rounded spine position. So I want you to round up the back as much as you can. Yeah, no hands. Yeah, round up as much as you can. And then we're going into the opposite direction. So we're going to arch the back as much as you can. Let's try that out. Yeah, just neutral position. So don't lean forward. Yeah. Then go back forward, round up position, arch position. Let's do that for 3 or 4 reps. Round up, arch up, slowly, slowly. So I want you to notice the position. Yeah, arch as much as you can and round up as much as you can. That's it. Arch up, shoulders back. Round up. You also, by the way. Arch up, shoulders back. Okay. Then guys, when you've done this for a few reps and you notice how it feels when you're in this position and how you feel in that position, we want to be in the middle throughout the entire movement. Maybe a little bit biased towards the arch position. So I want you to maybe arch it back a little bit so you notice how the erector muscles, so the lower back muscles feel. And then from this position, so when we have the good position of the back, then we're slowly going to shift the weight from the hips, so when we're sitting on the bench from our ass basically, towards our feet, slowly. Let's try that out. Maintaining the same position in the spine. You can even use a mirror for that if you have difficulty doing that. Let's try that. So we go from sitting on our butt towards standing on our feet, really slow. Stop, hold it here. Okay, from this position, what we're going to do is we're going to slowly get the hands on the object, but still, again, maintaining the same position. So, let's get the hands on the object. All right, stop. From now, from this point, what we're going to do now is slowly get all the weight from this point towards that point, so to the feet. So, raise your hips a little bit upwards. Maintaining the same position. Stop and go back down. So don't do that thing with the shoulders. Make sure the shoulders are in the same position. Slowly push yourself off of the bench. Go up. Hold it here. But I didn't say to you that you need to lift the medicine ball. All right. Go back down. Sit on the bench. So basically the ball is just a reference point on. We're not going to lift it. So we're going to sit on the bench, feet a little bit more backwards. That way. Okay, so we're going to try it one more time. Let's flex the spine, just to notice how it feels. And we're going to arch the spine. Okay, and then we're going to go a little bit back towards that rounded position, a little bit. Back towards that rounded position. Don't rush through the movement. All right, go back, rounded position. Arch position. One more time, rounded position. And then the arch position. Okay, and then we're going a little bit back towards that rounded position, but not too much. Yeah, stop. Shoulders a little bit more backwards. Okay, again, shift the weight from the ass towards the feet. Let's try that out. A little bit. Okay, stop. Then we're going to slowly raise the hips off of the bench and lean with the chest towards the floor. Let's try that out. Push the knees back. Push knees back. Yeah, hips up. Hips up, hips up. Stop. Hold it here. All right, now you see she's in this position. So just with the bar above the knees. Now I want you to slowly flex the knees, maintaining this good and flat position, and get the hands on the object or on the medicine ball. Let's try that out. Slowly go down into a semi squat. Hands on the medicine ball. Yeah. And let's lift it up. And go back down. All right, that's good. So when she's able to do the sequencing, good. She's able to maintain that neutral position. Now we're heading over into a deadlift with weights. So let's try it out. And the first thing we're going to practice when we're going over into big weights with a barbell is bracing our torso. So what we want to see during the bracing is that we always lift with tension on the core. If there's no tension on the core muscles, you shouldn't lift the bar. So the first thing that you'll do is it's what they call getting the slack out of the bar, is we want that click to be away. And that means that we have lifted the bar like approximately 1 millimeter off of the ground. So the forces of the bar are already placed upon our torso. So she gets the hands on the bar. Okay, squeezing the ab muscles, arching the back a little bit, just like we've done over there. Having that neutral position of the head, shoulders go back and down. So you want the shoulders to go towards the hips. Okay, and then from this position, when everything is okay, she pushes through the legs into the floor. When she's above the knees, she gets the shoulders back and finishes up with hip extension. When she goes down, hips go back, bar travels towards the knees, and when she's below the knees, then she flexes the knees. The reason that we do this, guys, is because, relax for a second. The reason that we do this is because if we do not do this, so if we flex the knees a lot, the bar will travel forwards. And this means that the bar path will not be straight. And we want it to be as straight as possible. And if we get the knees back and we get the hips back, we will maintain that neutral position, or we will maintain that straight line of the bar path, which we want. So we want the hips to go back, making room for the bar to travel downwards. Then when we've passed the knees, then we go into that knee flexion. So we'll do it one more time. One good deadlift with good tension on the torso, squeezing the abs, shoulders go down towards the hips, and we go up. Yes. Go back down. What we don't want to see during the setup of the deadlift, you'll see it quite often, is that individuals get the hands on the bar, there's no tension on the body, and then they immediately pull the bar upwards as quick as they can. This will create a lot of forces on the body where there's no tension. That's something we, again, don't and ever want to see. First, make sure that everything is nice and tight. Make sure that you've braced the core. Get the hands on the bar, get the slack and take it out of the bar, and then lift the bar up as explosive as you can. So guys, that's it for the deadlift. We're going into the medicine ball clean.